26 September, and it is the World Contraception Day. This is the day that was launched in 2007 to create awareness among young people, especially those between 14 to 25 years, about contraception, and to enable them make informed decisions about their sexual and reproductive health. The day has a vision of ensuring that every pregnancy is wanted. This particular day comes at a time in our country where we have witnessed quite an increased number of teenage pregnancies. And as such, so many people in our country have learned to embrace contraception. So it's important that we understand some of these reasons why people have embraced contraception.
Okay, there are various reasons where women of reproductive age decide to embrace family planning. One of them being education reasons. In this, I mean that early pregnancy may hinder the continuing of the education of this person and their career. So that's one of the major reasons, especially in the country. Another one is economic reasons, where a family decides just to have a number of sizable kids they can manage, and they can also space their kids so that they can be able to pursue their education and career effectively and well. There's also the reason of prevention of STIs like gonorrhea, and also the issue on peer pressure.
Okay, and we have several types of family planning method, and among these is the natural family planning method. We're going to start with the traditional one, which is the coitus interruptus, whereby a partner withdraws his penis from the woman's vagina when ejaculating to ensure that no semen or sperms come into contact with the ovum. Then we have the lactational amenorrhea. This particular method applies to women who are exclusively breastfeeding, and we have other natural family planning methods such as the Billing method, the base of body temperature, the 4 calendar rhythm, the standard days method, and simple thermal method, whereby all this method works by ensuring that you abstain during the fertile days to prevent any fertilization. Then we have the barrier method, and this barrier method works by preventing sperms from gaining access into the female upper reproductive tract. For the barrier method, we have things such as the female condom, we have the male condom, we have the cervical caps that are inserted into the cervix, and then we have the spermicide, which is the birth control method that has chemicals that stop sperms from reaching the ovum. And then we have the hormonal contraceptives, and among the commonly used hormonal contraceptives in our country are the combined oral contraceptives, which have both synthetic estrogen and progesterone. Then we have the progesterone-only contraceptives, which work by preventing ovulation, whereby they suppress the ovulation hormone, that is the luteinizing and the follicle-stimulating hormone, as well as weakening the cervical mucus to ensure that no sperms penetrate. For the combined pills, we have an example of the microgynon pills, which are 21, and you're supposed to take these pills for 21 days every day, preferably at the same time of the day. And then we have the Femiplan. Femiplan, it is good to note that it has 28 tablets, and these tablets, among these 20 tablets, only 21 have hormones, with 7 of them having iron, so they do not prevent you from getting pregnant. For the Femiplan one, you're supposed to take one every day for 21 days, then you continue with those ones for the iron, then you start again after you are done with 21 days. Then we have the progesterone only method, and an example of this is the Macrolute. The Macrolute has 35 pills, which again you're supposed to take every day, and ensure that you take them at the same time of the day. It is also important to note that for combined pills, these are not indicated for women who are breastfeeding, because estrogen usually suppresses milk production. Then we have the emergency pill. These are the pills that are taken within 72 hours of unprotected sex to prevent fertilization or to delay ovulation while inhibiting egg and sperm transport. Then we have injectables such as the Depo-Provera that is given every 3 months by trained personnel. And it is good to note that for Depo-Provera, it can be given 1 month earlier or 2 weeks late. Then for the last hormonal contraceptive method is the implants, and this is whereby we have small rods that are inserted they are inserted under the skin of a woman's upper arm to release hormone progesterone in controlled rate. We have different types of implants, and we have the 6-capsule Norplant that gives protection for 7 years, and we have the 2-rod Jadel that gives protection for 5 years, and a 1-capsule Implanon that gives protection for 3 years. It is important that when you're going for the insertion of these implants, that you go back for a follow-up after a month, then once every year.
There's also another method, which is the IUCD, which is a device that is inserted into the uterine cavity through the vagina, and this method is safe and highly effective. We also need to know about the mode of action, which IUCD immobilizes sperms. It also inhibits overproduction. It prevents implantation, and it also interrupts and interferes with the fertilization. There are 2 major types of IUCD. There is the non-hormonal releasing IUCD. An example is the copper T, which is the most common, and the multilode. There is the hormonal, which the major one is the Novogestrel Mirena. And there are various contraindications of using IUCD, which are a woman who is known or suspected to be pregnant, a woman who has STI, or a woman who has pelvic cancers, or even if the woman has purulent cervicitis. Yes.
Okay, and the last method is the permanent method, which is not advocated or advised for young people because it offers permanent protection against pregnancy. And for women, these include the tubal ligation method, which can be done by a mini laparotomy, whereby a doctor makes an opening into the abdomen to access the fallopian tube, either cut them or tie them. Then the doctor can also do the tying and the cutting of the fallopian tube through a laparoscopic procedure, or during the CS, or during any other abdominal surgery. Then for men, we have the vasectomy. This is where by the vas deferens is cut to prevent the sperms from mixing with the semen. And it is important to note that this is not for young people, and if it is indicated or given to young people, it should be given with caution.
Okay, in this regard, the WHO formulated a will in which the healthcare providers will be using it to recommend the safest and most effective family planning methods. This will, you can easily find it in Play Store. At the top, there is the list of medical conditions. There's also the various methods of family planning, and at the lower part, there is the eligibility criteria, in which 1 represents you use the method in any circumstances, 2, you can generally use the method, 3, you will only use the method if there is no other appropriate method available to be used, and 4, you are not recommended to use that method. An example, I will use an example of a person who is suffering from cardiovascular diseases. For this patient, the woman is not supposed to use combined hormonal contraceptives, but the most effective and safest method is the copper IUD and the Linovogestrel IUD. Yes, you can download this app from Play Store and use it to know which appropriate method you're supposed to use.
Okay, it is important to note that among all the methods that we've mentioned today, majority of them have side effects apart from the natural family planning method. And it's also important to note that these methods, while they prevent you from getting pregnant, they do not prevent you from getting STIs and HIV/AIDS apart from the barrier method. For the barrier method, it protects you from STIs and at the same time protects you from getting pregnant. As such, we are going to show you how to use both female and male condom. Thank you. Thank you guys for watching. Thank you so much, and subscribe to our YouTube channel, like, comment, share, and please turn on your notifications so that you are notified anytime we upload a new video. We love you so much. Thank you. Protect yourself against pregnancy.